Today, we are going to be discussing a normal ECG in a sick patient. Um, One of the most dangerous ECG situations you will ever meet on shift is a normal ECG in a sick patient. And the context is that for you, the context is you're probably in the emergency department, you're in the general practice or your family practice, family medicine practice, or you are on the ward. Why? And why does this matter? It's because the level of risk differs. If you're in the emergency department and you're seeing a normal ECG, even in a patient that is symptomatic, you're a bit calmer because you have quick access to investigations. But if you're in your community practice, or you're in the community and the patient is symptomatic even with a normal ECG, then the risk becomes a bit more. If you're on the ward as well, you have access potentially to a lot of support. And so the context can matter for you. Now, let me show you this ECG. It is dangerous. Now, this is a first of seven parts of a seven-part series of ECGs. So this is part one. In the following ECGs, I will be doing a quick summary of how you know an ECG is normal. But let's assume you have a framework or you're using my framework, which is the RAIC method, and you've scanned this ECG and it is normal. Bad news, this is a dangerous ECG potentially. The patient is sick, right? The patient is properly sick, febrile, a bit tachycardic, but as you saw from the ECG, when you did the ECG, it was normal. Hypotensive earlier on, they look gray, they feel awful, and the ECG looks fine. No crushing chest pain, so we downgrade the risk. We say, well, the ECG is fine. They had chest pain, but no current chest pain. But however, the nurse or your colleague, because your other colleague or even the HCA who does the ECG for you tells you the patient looks really unwell, don't they? And this is where people relax. This is where the mistakes happen. We wait for the troponins as if they are the truth serum. When you're in the emergency department, you're like, I'm just waiting for the troponin so I can discharge the patient. But the reassurance trap is powerful. The question is not, is this ECG normal or is there any ST elevation going on? The question is, what is this heart doing? Is the heart coping with the physiology right now? Because, there's no dramatic ST elevation, everybody breathes out and they wait, for bloods, for troponin specifically, as if it's a lie detector. The only question that matters is, what is this heart doing? And the red flags that I would like to discuss with you, despite a normal ECG is there persistent tachycardia out of proportion to fever? So you're doing the temperature and it's just slightly over the top, maybe 37.5, and they're having maybe a tachycardia that is persisting and is not in proportion to the fever, or they're having new or worsening hypotension. You check their blood gases and you see a high lactate, or you see, findings of a metabolic acidosis. They're having hypoxia, they're having increasing oxygen requirement, or, just those borderline patients where the ECG is 93, 94 when they're resting, but the moment they move around, the ECG drops to about 88, 89, or 86 even. I've had a patient once like that who had a normal ECG, but the moment they mobilized, that was the first clue to tell me that this patient could not be fit to go home. So they have chest discomfort that is vague, atypical, or dismissed. They have high risk physiology with a quiet ECG. These are all clues because this patient ended up having sepsis. In sepsis, oxygen demand explodes. The heart rate goes up. Afterload drops, coronary perfusion suffers, and the myocardium can become ischemic without a blocked artery. And that is what we call demand ischemia. And the ECG in that case does not owe you any drama. So what should make you uneasy if the ECG looks okay? These are the red flags that I've discussed. Now, ECG clues that are easy to ignore is when you see sinus tachycardia that does not settle, you see subtle ST depression or T-wave flattening in a number of leads. You see the normal loss of normal STT concordance. Again, this is something you should stick around for. If you're watching part one, subscribe to this page so that you can get the other 6 parts of this ECG, these 6 parts of this Workday ECG series we are doing. So if you're having dynamic change over time. So you do a first ECG, and the HC has left the ECG leads on because they felt that, in their many years of practice, they know an unwell patient themselves, and they've felt that, oh, this doctor or this nurse or this clinician might want to repeat ECGs, and you happen to do another ECG and you're finding dynamic changes. I've seen quite a few cases of this where the first ECG is normal and the other ECGs, based on good clinician suspicion, based on acumen, they repeat the ECGs, and then low be it, you find serial ECG changes, right? Because if you have chest discomfort that is vague and brushed off, those things should point you to do serial ECGs, right? So small dynamic changes over time rather than one big abnormality, nothing flashy, but together they'll tell you that the heart is under strain. And that's not reassurance. That's a big red flag. That's a warning. You compare that ECG. If you're not sure, you compare it to the old tracings. You check serial trops, knowing that the troponins may rise later, especially if they've presented to you within a fairly reasonable. Some centers will say 6 hours, some will say 4 hours of chest pain. Do not discharge a sick patient just because the ECG behaved itself. Now, here is the one line I want you to remember on shift. A normal ECG does not mean a safe heart in a sick body. You have a sick body, you have a normal ECG, it doesn't mean they are safe. Now, there are these are ECGs you will actually see, the ones that look fine, the ones that get missed, the ones that hurt patients. I've seen a patient come the previous day with a normal ECG, and the following day they came in with chest pain, and we could not resuscitate them out of the heart attack. So in case this ECG made you pause, stay with this series, turn on notifications, follow our Instagram page, because we are going to be doing a 7-part series on this, and that's how important it is. See you in the next one.